Welcome. Technology now allows people to connect anytime, anywhere to anyone in the world from almost any place. This is dramatically changing the way people work, facilitating 24/7 collaboration with others. A very hearty good morning to Mother. Welcome to the live webinar organized by the Department of Library, Abeda Inamdar Senior College. We are here to share with you all the views of Dr. allows people to connect on how anytime, anywhere to anyone in the world. COVID-19 pandemic is the greatest challenge. This is dramatically changing. Change is inevitable. Facilitate our 24 ways to lead our lives and perform our codes at the very heart of one of the ways being an online mode of interaction. The secret of change is to focus all of our energy not in fighting the old, but on building the new. Now, I request our beloved principal, Dr. Shaila Butwala, to deliver the welcome address.
Good morning, everybody, and welcome to this seminar on Beat COVID Together. I should congratulate our library department, especially the librarian, Noorjahan Sheikh, and convener of library committee, Amrita Bhatia, for having this seminar at this very opportune moment when Maharashtra seems to be on the brink of another COVID outbreak. COVID, if we all come together, cannot stand in front of us. But there are some things that we need to do. There are some things that we need to know. There are some myths that we need to understand and fight against. I would request our speaker today, Dr. Afreen Pathan, to throw some light on the variations of information that we are receiving about COVID, about its vaccine. So if she can clarify some basic concepts for our students so as to move everybody in the right direction so that we are all doing the right thing with the right reasons. So Afreen, if you can do that, that will really be wonderful. Looking forward to wonderful interaction between the students and, academically informative lecture from you. Thank you so much.
Thank you, ma'am. Hello everyone and welcome to today's session. I am Noorjahan Sheikh, a librarian of Abeda Inamdar Senior College. I would like to introduce our today's speaker, Dr. Afreen Pathan. She is one of the best speakers in the state and has been invited by several prestigious institutions to share her ideas on COVID-19. Along with her Bachelor of Homeopathic Medicine and Surgery, she has done her postgraduate diploma in emergency medicine and postgraduate certification in clinical research from Jahangir Hospital, Pune. She has worked with Jahangir Hospital and Ruby Hall Clinic, and currently she is working with a United States healthcare company into healthcare analytics domain. So, dear students, please join me in welcoming Dr. Afreen Pathan.
Good morning, everyone. I'm Dr. Afreen Pathan, and I welcome you all for today's webinar on COVID-19 awareness and precautions. First of all, I would like to thank our principal, Dr. Shaila Butwala, our convener, Mrs. Amrita Bhatia, and Noorjahan ma'am for inviting me for today's webinar on Beat COVID-19. Also, it gives me a lot of pleasure to come back to my institution, the place from where I've passed. So, being an alumna of Scholar Batch, I really feel very great and very nostalgic coming back to this institution. Thank you, Inamdar sir, for giving me this opportunity. So the motto for today's seminar will be precautions and awareness. I'm very sure that you all know a lot about this disease. But in this webinar, I'll be giving you some tips or the basic principles that you can apply to your day-to-day living and the basic things that you can do to help stop the spread of this virus and to yourself and your family members at the basic primary level. So let's start in understanding that what exactly this disease is caused by. Right? So this disease is caused by a virus. Now, what is a virus? A virus is a non-living thing. As its own, it does not live. It always needs a host to multiply. So I'm sure all the science students over here might be knowing this. So a virus always needs either an animal or a human being to multiply. So the coronavirus that we are going to study today, or we are going to just discuss today, is the family that is causing all the havoc. So all the viruses, that is MERS virus or the SARS virus, the severe acute respiratory syndrome virus that was there a few years back, or the Middle East respiratory syndrome, these all are part of the coronavirus family. So as you all, let me just explain you in a simpler way. Human being to multiply. There are so many families living in this community. For example, you take a family like a Khan family, a Mahajan family, any family is living, and in that family there are around 10 to 15 members staying, right? So every member is different, every individual is different in that family. Some people are very mild, the other member of the family is very agitative, the other one is very violent. Same goes with this family. So the coronavirus family also has many members, many viruses in it. Some viruses are very, violent. Some viruses are so mild. I mean, they create symptoms which are so mild, or they create symptoms which are so violent or fatal. So one of this virus is SARS-CoV-2 virus, which causes COVID-19 disease. So COVID-19, as you know, is called so because co is the CO word is come from coronavirus, VI is the virus, D is the disease, COVID, and 19 since it was first found in Wuhan in China in December 19. The reason why it is called as COVID-19. Okay, now this virus, it actually is very infectious and it spreads at a very higher rate. And WHO has called this disease, that is COVID-19, as a pandemic. So pandemic is something that is, universal or spread throughout the globe, across the continents. You might have heard the word epidemic, endemic. The similar is pandemic. Epidemic is where the disease is spread only in a particular city or in a particular country. And endemic is just residing to that community. For example, malaria, which is there only in the tropical areas. It is endemic to that tropical area. Similarly, swine flu, AIDS, now COVID-19, these all are pandemics that is spread throughout the globe. We'll see how this disease spreads. So this disease spreads only by two means. First is by droplet infection, and secondly, if you by your hands, if you sneeze on your hand and you touch that hand somewhere else, the disease will get spread. Now let me tell you, this coronavirus is such a small virus, and it is can you see the tip of this pencil? There might be millions of virus which can stay at the tip of this pencil. So you can imagine how minute the virus is, and say in case if you just sneeze in public, how many viruses are you gonna emit? Okay, so it is our responsibility to always carry a kerchief whenever you are into public places. So this is a high rate of transmission of this virus. Now this, let me just show you. I have a rough figure of this virus. This is how roughly the virus looks. Okay, so it has a genetic material, a single genetic material, which is called as an RNA, and surrounded by a lipid layer, a double lipid layer, and then these are the protein spikes. Can you just see that these protein spikes are in a shape of crown, the one that you wear on your head? The reason why it is called as coronavirus, so the word corona comes from crown. Okay, the reason that it is called as coronavirus family. Also, it is seen that, whenever you touch any place where a person has sneezed, and then you touch that hand to your eyes or your nose, the T zone of your face. So this is the T-zone of your face, which is very, very infective. So you touch your eyes, you touch your nose, and you touch your mouth, immediately you tend to catch COVID-19. Now, we've been around 10 months in this pandemic, and we are still studying that how exactly this virus works, this disease progresses. And we have seen that the virus is also found in the feces. But as of now, there is no data that shows that the spread is through feces. So when you know that the spread is only by the droplet infections, and when you are touching that droplets, and then you are touching your nose or somewhere, so I think we have the answer to it right in front of us. The thing is that we should sterilize everything. We should carry a sanitizer with us. You all know, but the sanitizer should contain the alcohol content more than 60%. We should tie a mask every time we go out. It is our responsibility that we do not transfer the viruses to the other person. Now, there are many questions as to which mask we should use. So I'll be showing you a surgical mask. Okay, this is the best mask that one can use. The procedure to use this is, you'll see a thick thing over here. So you just need to, make sure that this thick line comes over your nose, and you wear it this way. Okay, so a surgical mask is a 3-layered mask, and it always helps in spreading the virus outside. Whereas the N95 mask, that is also good, but that helps in spreading. It stops the virus from entering in. So N95, it stops the virus entering in, and surgical mask helps in spreading the virus out. So either of them is good, but I think that the surgical mask should be kept for the healthcare people. They need this the most. So even if you wear a simple cotton mask, I think that should suffice. Also, whenever you sneeze, you should carry a kerchief, as I said, and in case you don't have a kerchief, at least make sure that you are sneezing on an elbow. You are not sneezing in the air, in the open. As I showed that you can understand that how severe it is to even sneeze once in the air, because millions and millions of virus get transmitted. Also, you people as youngsters might be playing sports. While playing sports, always carry your own equipments. Always sterilize your equipments before using, also after using. Make sure that you all sanitize your hands, you all wash your hands with soap. Whenever you all wash your hands with soap, this lipid layer breaks down. In case you don't have a soap, you can use a sanitizer, only if you don't have a soap. So you need to wash your hands for minimum of 20 seconds. Now, the data has shown that 40% of people having COVID-19 do not have any symptoms at all. 40% of them have very mild symptoms, and 15% of them have severe symptoms which need hospitalization, and 5% are those which land into all the complications and they land into ICU. So I think I'm here to target the 80% of the population which falls into, very less mild symptoms or no symptoms at all, which are the youngest population of the community. So the symptoms over here that you can see is fever, cold, cough. You may have a slight breathlessness. Then there is loss of taste or loss of smell, that is anosmia. So you'll have multiple symptoms, or it may happen, as I said, you may have no symptom at all. So you should be very cautious, as in whenever you have sneezing, whenever you have fever, please stay yourself isolated. Do not go outside. See to it that you do not spread your infection to anybody else. Now, a very important thing that I want to tell you, that during these trying times, everyone at your home should be carrying a COVID-19 kit. I'll tell you what exactly the kit should have. It should have a mask. It should have a sanitizer. It should have the basic supplements, the basic multivitamins, basic calcium supplements. These tablets should be there in each one's house. Also, if you have aging parents and you have grandparents at home, then it is a good idea to keep a BP apparatus, a digital BP apparatus at home. This is a betadine gargle that you need to keep. I'll explain you how you need to use all this. This instrument is called as a spirometer. You will be getting this online, or you can get it in any surgical shop. This is again a very useful instrument. I'll let you know in the further video that what exactly you need to do with this. But this comprises the basic COVID-19 kit. And one more thing is a pulse oximeter. Okay. Now I want you all to know that when exactly you have to go to the doctor, you should be assessing yourself whether I need to go to the doctor or I can treat all my symptoms on my own. Because right now the pressure on the healthcare is so much that people with very mild illnesses are approaching to clinics and hospitals, and the people with the major symptoms like breathlessness and the people who need ventilator, mechanical breathing support, they are not getting hospitals, they are not getting beds. So I want you all to know that where at what stage you can treat the disease at home. So the first thing that this is a pulse oximeter, and I'll show you how you need to record your oxygen levels. This helps in recording the oxygen level in your blood. Take your index finger. Make sure you have not applied any nail paint on your index finger, otherwise it will not give a correct result. Place it inside and just press the on button. Wait for some time. Okay, it will give you the reading. So my reading right now is 98%. Anything above 95% is a thing to worry. Okay, if your SpO2 is less than 95%, you need to go to the doctor. It also shows the pulse. My pulse right now, it's giving me some 89. Okay, so if you have a pulse rate of more than 110, you need to go to the doctor. Please note all these things. Okay, if your blood pressure, as I said, if you have a digital BP apparatus at home, you need to check your blood pressure. If your blood pressure, the systolic blood pressure is more than 110, the normal blood pressure is 120/80. If your systolic blood pressure dips less than 90, okay, then you need to go to a doctor. Ideally, it should be 120 and above. Okay, then as I said, this is the betadine gargle. What you can do with this is you can dilute this. You can take half or rather 1 spoon of this betadine gargle, mix it with half cup of warm water and just gargle. So that will help in, easing the infection. So the infection in COVID-19 is a viral infection, while this is antibacterial. But the thing is, when you have a viral infection, you tend to have secondary bacterial infection very easily. So this will help in that. Also, if you have fever, you can start with tablet paracetamol 500 mg. Okay, so if you have cold, with that you can take a tablet cetirizine 10 mg OD, that is once a day, and you can have that for 3 days. In case if after 3 days your temperature is going above 101 degrees Fahrenheit, then you need to go to the doctor. Please make sure, I forgot to show you one thing, you need to have a thermometer also with you, so to note down your temperature. So note down your temperature twice in a day in case you are having fever. If your temperature is more than 101 degrees Fahrenheit for more than 3 days, make sure that you get yourself checked by a doctor. Also, if you're having a lot of breathlessness, you are having a lot of confusion, a mental confusion, then you're having a lot of knee pain, a lot of muscle pains, then stroke-like symptoms, cramps in your hands, a lot of dehydration. These are the symptoms that, when you should reach out to your doctor. Also, as the supplements that I showed you, you should have vitamin C and a multivitamin at your home. So preventively, you can start with vitamin C. The recommended dose is 500 to 1000. So you can have that. A normal tablet normally has 500 mg dosage. You can take 2 tablets in a day, or you can take 1 tablet in a day. This is only for people who do not have kidney problems. The people who have kidney problems, please make sure that you go and consult with your doctor. The recommended dose for kidney problems is 100 mg for vitamin C. Okay, so this is all that you can do. You can keep this healthcare kit at your home, analyze yourself, check yourself how much is your SpO2. Also, if you are not feeling breathless but your SpO2 levels are decreasing, as I showed, mine was 98, and if yours you check and it goes somewhere around 95, 94, but you don't have any breathlessness, still you will be going to the doctor. Now, this condition in medical terms is called as happy hypoxia. That is, you have the oxygen level in the blood goes on dipping, but you don't have any symptoms. That's the reason it's called happy. And hypoxia is that the oxygen in your blood is less. So this is the time that you go to your doctor. Now, once you go to the doctor, your doctor will give you a test, a COVID-19 test that shows either positive or negative. Now, let me explain you. There are basically 2 types of tests. One is RT-PCR, that is reverse transcriptase polymerase chain reaction. And the other one is rapid antigen test. Now, antigen, you might be knowing that is something, that causes disease in your body. So this virus now becomes an antigen. So any antigen is something that causes disease in your body. And when your body reacts to it, it creates antibodies to fight towards this antigen. Okay, so this is the basic difference between antigen and antibody. So they do the rapid antigen test. Now, this rapid antigen test is normally done in areas where the government screening is going on. So you might be seeing that there is a screening going on at a nearby hospital or in a school. So the test that they do over here is rapid antigen and not RT-PCR. So the test results you get in 15 minutes. It is just like a UPT kit. You just take a nasopharyngeal swab and you check it in that kit. And then you get the symptoms, you get the results, in 15 minutes. But the thing is that while doing this, you need to have fever or you need to have some or the other symptom. Only then this test will be positive. Otherwise, it will show false negative. The other test that normally the doctors recommend is RT-PCR. Now, this test takes around 6 to 12 hours to give its result. But then it is a bit expensive, but yeah, it is, a bit of confirmatory rather than rapid antigen. Also, I would like to tell you that there is a term called as CT value, which is cycle threshold. Now, this tells you that what exactly is the viral load in your body. Now, CT value, cycle threshold, is always inversely proportional to the viral load. So the normal CT value is around 40. Okay, so if your CT value is around 29, it is inversely proportional, I said, to the viral load. So if the CT value is less than 40, say around it is 20, that means the viral load in your body is very high. You have a lot of virus in your body. Okay, suppose if your CT value is around 39, 40, that is good. That means your viral load is less because it is inversely proportional. That means you are just at an initial stage of the disease, or probably you are recovering. Okay, this is all that you need to know about the test. Now, you've done the test and it turns out to be positive. What are you going to do? Don't panic at all. There's nothing to be panicked. You need to cut off yourself from others. You need to isolate yourself. Okay, now let me tell you what is the difference between isolation and quarantine. Isolation is when your report is there with you and you are positive and you have to cut yourself with others. Quarantine is something that you have been exposed to a person who is already positive, and now that you may develop symptoms because you have come in touch with that person, so you need to be quarantined. So you need to be kept aloof. Now, this is the basic difference between isolation and quarantine. So you need to isolate yourself from others. Now, quarantine, this word, there's a very interesting fact behind this, that the word quarantine has come from the word quarantina. In Latin, quarantina means 40. So back then in the 14th century, there was this pandemic called as Black Death or the Black Plague. So when ships used to come to the shore, they used to make sure that 40 days the ships are at the shore. People do not enter inside the landmass for 40 days. Okay, so from there, this 40, that is quarantina word comes. So this is how we derive quarantine. So now you will isolate yourself. Now you'll take the medicines that I told you, the antivitamins, paracetamol, anti-flu, and all. Most of the patients, majority of the patient will get well in next 4 to 5 days by taking these initial precautions. You can take steam, you can eat well. Further, I'll also show you some different methods that you can do. But the remaining, people who do not improve, then they will need to go to the hospital. Now I'll tell you, there are many medicines. Once you reach the hospital, there are many medicines that will be started to you. That is remdesivir, then there will be anticoagulants. Now this disease is such that it causes, thickening of the blood. It coagulates your blood. So a doctor may give you anticoagulants. You may be given HCQs, that is hydrochloroquinines, which are used to, treat malaria. These drugs are all used, dexamethasone and all. These will be given to you in the hospital. But as I told you, there's a very few chunk of people who will necessarily, need all these medicines. Secondly, that you need to focus in this is, first, you'll be given medicines and all. Secondly, is that what you can do to improve your immunity. You need to improve your immunity. And third is that you need to improve your lung function. Since this disease primary, it just affects your lungs. So you need to improve your lung function. Now I'll tell you what exactly you need to do to improve your immunity. Now there are so many things in the market which say that you take this amla syrup, you take this syrup, and yes, it will improve your immunity. Trust me, do not go for any of such, because all of them will have preservatives in them. And there is no such thing that you take a single medicine or you take a single remedy and your immunity is boosted and then you will not be affected by any virus. No. Immunity is based on multiple things. It is kind of a triangle, a physical, which has 3 points. So a physical plane, a mental plane, and a spiritual plane. Okay, so we need to heal all these 3 planes to obtain a maximum immunity. So please pay attention what you need to do basically. So you need to, for the physical plane, to improve the physical plane, you need to have a very good diet. Whenever you have your food, make sure that your plate is completely colorful. There is a lot of greens in your plate, a lot of reds in your plate, like carrots, beetroot, green vegetables. Then you have a lot of proteins in your plate. So if you are a vegetarian, you can have a lot of sprouts, you can have a lot of dals, soya beans. These all are very rich in protein. If you're a non-vegetarian, you can go and have meat, you can have eggs. Make sure, but when you are having eggs and meat, that they are, eggs are hard boiled and meat is very good cooked. Because if it is, not that well cooked or it is half cooked, you may then again land into salmonella infection, which is typhoid. So make sure that you are, boiling it pretty well before having it. So I recommend that you go for vegetarian protein rather than taking a risk of having salmonella again. It will be very difficult to manage 2 infections at the time. So yeah, you'll have a lot of proteins. You can have carbs, vitamins. You can have all these, your diet should be full with nuts. You can have almonds, walnuts. You should be having a lot of herbs like tulsi and oregano, a lot of spices. Also you can have chavanprash. It is a very good thing to improve your immunity. Then again, you should be having 7 to 8 hours of sleep every day. However busy you are and whatever routine you follow, make sure that you are having a very sound sleep of 8 hours. That is going to rejuvenate yourself, and it is going to help boost your immunity. Also, you need to hydrate yourself. Have a lot of water, around 2 liters of water every day. So this is all that you can do, and the supplements that I told, vitamin C and multivitamin, take it regularly. This is all you can do on the physical plane. On the mental plane, what all you can do is you can do all those things that make you happy, that relieve your stress. Now, the lifestyle that we are living, each one of us is loaded with a lot of stress. Give yourself a little bit of time every day. You can catch up to any exercise. You can do yoga, you can do meditation, listen to music, take out time from your busy routine every day. Give time to yourself to help to improve your mental aspect. And then you can call your loved ones, you can have a chat with them. That will help releasing the happy hormones, endorphins. And you can have a walk, daily yoga. Also, in the spiritual way, you can connect to God, and I personally feel that we all should do this regularly. Connecting to God is really very important. Every day, make sure that sometime you pray, take out time that you pray to God, you connect to God. That will help in the spiritual healing. So and also then you should focus on a lot of positivities. So as you know that there's a lot of havoc now, that COVID-19, and too many news coming up, all fatalities and all. But in all this, you should find some positive things. So you can, you've seen that, the emissions outside have decreased. You have got so much of time. Imagine this pandemic would have not been there. You would have never got so much of time. You wouldn't have been staying at home with your family, except for healthcare workers. Others are definitely are at home. They are students like you all are studying at home. I mean, you all have been blessed with so much of time. Further in your life, I don't think people will ever get so much of time at home with your family. So in a way, though there are many negativities, but yeah, you can still find positivity in all this, right? So you can you can focus on all the positivity, and I'm very sure that when you think about all this in a way, on the spiritual way, on the mental way, and taking all the supplements, you can easily conquer this disease. This disease is nothing more like cancer or something. It is a very normal disease, and if you have the willpower, if you have a very good mindset, in a few days you can help combat with this disease. The only thing is, do not panic, and everything is curable. Now, the third thing that I want to say is to improve your lung function. We've seen how to improve your immunity. Now, the third and the last thing is how to improve your lung function, which is very, very important, trust me. Now, when we discharge patients from the hospital, we normally give them a schedule of, exercises which they need to do. So, in case if you have COVID-19 or you have just recovered, any of your family members have recovered, even if you do not have any lung infection, you still can do these exercises. Trust me, these exercises will help your lungs boost its lung capacity. For this, we need to understand that our lungs are basically placed in the behind part of your thoracic cavity, not in front. It is behind. So when you sleep, always remember that you do not sleep on your back for a longer period of time, because then the lungs get compressed. See to it that you are either sleeping on the right side or either on the left side, and in between on the tummy, so that there is enough aeration for the lungs and there is a good air entry. Also, the lungs are not a muscle. Always remember this. Lungs are not the muscles, but the muscles surrounding it help in the respiration. So there's a muscle over here just below your chest cavity. It is called as the diaphragm. So the diaphragm actually separates your thoracic cavity with your abdomen. So your chest and your stomach, which you say in lay language, the abdomen, that is, cut off by the muscle in between, that is the diaphragm. It separates. This diaphragm, when you are respiring, so this diaphragm goes up and down, and in a way you breathe. So this diaphragm, you should focus on strengthening this diaphragm. Further over here in the rib cage, we have the intercostal muscle in between the ribs. These are the muscles which are, in between like these. So when you breathe, these muscles come out and in this way. Okay, so my focus over here is to train you, to improve your muscles, the intercostal muscles and the diaphragm, which help in breathing. Now you remember if I had shown you this spirometer. So this spirometer is an instrument, a very small instrument, but it will help your lungs be in a very good condition. It has two parts. This is the mouthpiece and this is the main body. You need to connect this over here. The flat thing, you put it in your mouth. Keep the spirometer at an angle of your chin. Now we'll be, right now I'll be showing you the exercise for the inspiratory muscle. So inspiration is when you take the air inside. Expiration is when you leave the air outside. Okay, inspiring, expiring. Okay, so muscles, the intercostal muscles and diaphragm are divided into inspiratory and expiratory muscles. So there are exercises which help in these muscles. Now I will show you inspiration muscle strengthening. So what do? You take in the air for inspiring. The same way you need to take the air in. Leave it. Okay, so you need to do this 10 times in the morning, 10 times at night. Now we'll be working on the expiratory muscles. Okay, so you need to push air out because you are expiring. Okay, a normal person like you and me will only be able to blow up 2 balls, but a person who is trained in this or who does this regularly will be able to do the 3rd ball as well. Further, it also has the measurements over here. This shows the lung capacity, how much air you're able to blow in. So at the end of your exercise, after a few months of practicing this regularly, you should be able to blow all these 3 balls up. Okay, now in case if you don't have a spirometer, you can still do these exercises by sitting in your place. While doing work from home, sit on your chair and do these exercises. Okay, the next exercise that I'm going to show you is abdominal breathing or diaphragmatic breathing. As the diaphragm is situated over here, near the abdomen, it's called as diaphragmatic breathing. So when you inspire the air inside, make sure that your abdomen goes out. When you exhale the air outside, your abdomen comes inside. Okay, so you are inhaling air inside and exhaling air outside. Okay, make sure that you concentrate on your abdomen. Now this coordination seems to be a bit difficult, but once you are used to it, I'm sure it will become very easy. Okay, this is called as abdominal breathing. Next is apical breathing. Now the tips of the lung lies over here, right? So you'll take your fingers and then below the collarbone over here, you'll place your hands. And when you inspire, you feel the air, you feel your lungs expanding. Okay, you push this inside. Okay, do this multiple times. Make sure when doing all these exercises, you do not do in a hurry. Be very slow, otherwise you'll land into a spasm. Next exercise is shoulder shrugs. What you need to do is raise your shoulders, okay, while inspiring the air, and while exhaling, just leave the shoulders down. Okay, you can do these multiple times. Then it is elbow circles. The same thing, elbows up. Now here your focus should not be on your elbows or on the shoulders. Focus should be on the breathing. Okay. But only the thing is, when you do this, your muscles, your intercostal muscle raises. That is the reason you need to do this. Another important exercise that I want to show is the towel stretch. Okay. Take a towel over here. Just behind your back where your diaphragm is. Since it strengthens your diaphragm. What you need to do is just make a notch of it. Okay, when you inspire, when you take the air in, you are going to tighten the knot. When you exhale outside, you're going to loosen the knot. Okay, please watch. Okay, do this multiple times. Make sure you're very slow in doing all these exercises. Then is an inspiratory hold. You need to take the air inside, hold it for 5 seconds and then leave it. Okay, do these multiple times. Then the next exercise is sniffles. Just take in and leave it. This you need to do a bit rapidly. This you can do around 20 times in the morning, 20 times at night. So all these exercises in short are very useful, and these exercises are the ones that are recommended by the hospital when a patient gets discharged. Very useful exercises that will really help you strengthen your lungs. Even if you do not have any complaints, trust me, you can do these exercises and these will definitely benefit you. So with all this knowing, I hope that by now you all might be having a lot of knowledge about how to help yourselves in this pandemic, to keep the positive vibes in your mind. And with all the medicines, the physical factor, the mental and the spiritual factor that I've told you, keeping all this in mind, I'm very sure that we all will be able to fight this pandemic in a very good way. So thank you everyone, and I hope that you all stay very safe and stay very healthy. Thank you.
Thank you, Dr. Afreen, for your wonderful session. On behalf of Abeda Inamdar Senior College, I express my gratitude to Dr. Afreen Pathan for accepting our invitation and sparing her valuable time with us. Ma'am has delivered an extremely informative and interesting session in the critical times of pandemic, which is actually the need of the hour. I am extremely grateful to our beloved principal, Dr. Shaila Bhutwala ma'am, for her constant guidance and motivation. A heartfelt thanks to Mrs. Amrita Bhatia ma'am, convener of our library committee, for her continuous and prompt support. Also like to thank Mr. Kamil Khan, Assistant Professor, BCA Science Department, for rendering constant help and entire technical support. Last but not the least, I would like to thank all the participants and my fellow colleagues for their enthusiastic response and making this event a grand success. Till then, stay home, stay safe.